Hello guys, I hope you're well. So today we're going through warfarin, and the first point that we need to highlight is warfarin is used for anticoagulation. So it's not a DOAC, but it's used for anticoagulation. That's the first point. So an important point to understand is the fact that there is a starting dose of warfarin, so it's titrated, a bit similar to ACE inhibitors. So first and foremost, what are the things that you need to monitor before initiating warfarin? You need to monitor a full blood count, baseline full blood counts, FBC, an LFT, and coagulation screening, including PT or INR measurements. First point. So FBCs, LFTs, coagulation screening, which includes your PT or INR measurements. This is before initiation, right? So the typical induction dose of warfarin is 10 milligrams daily for 2 days, but this should be tailored to individual requirements. So let's kind of recap. So if I was to ask you what are the things to monitor before starting warfarin, or they could ask you um, which of these following drugs or which of these monitoring parameters are measured before initiating warfarin, and they could give you a whole list of them. So if NFTs is there, then it's that. If baseline full blood count is there, is that. If it's coagulation screening is there, is that as well. So baseline full blood count, NFTs, and coagulation screening, including PT or INR measurements, should be taken before starting treatment with warfarin. So 5 things. Baseline full blood count, NFTs, coagulation screening. Coagulation screening includes PT and INR or INR measurements. The typical dose of warfarin that you start with is 10 milligrams daily for 2 days, but this should be tailored due to the individual's requirements, and a low starting dose is often more suitable for or elderly people. People with a low body weight, people with liver disease or cardiac failure, and people at risk of bleeding. Main doses depend on the PT reported as an INR. It's very important. The INR should be checked daily or on alternate days in the early days of treatment. Once the INR has stabilized in a target range, the INR can be monitored at longer intervals. INR can be monitored more frequently in people with an increased risk of overcoagulation, for example, those with hepatic liver or renal disease, and those with adherence may be difficult. So let's start again. What are the 5 monitoring points before starting warfarin? The 5 points will be based on full blood count, um, so coagulation screening, as well as NFTs. And the coagulation screening includes INR or PT measurements. So your typical induction dose is 10 milligrams daily for 2 days, and there's a lot of important things like when you keep INR with your daily on all different days, and it's really more frequently with those in liver disease.